Close it here. Now what you have to know is the clavicle is example for the long bone, but it is placed horizontally in the body. It is the bone which is developed from the membrane. All long bones are developed from the cartilage. There is an exception for the clavicle. It is the membranous bone, placed horizontally, right? No medullary cavity, and it is occupied by one primary center and two secondary centers. I repeat, there are four special qualities of this clavicle. It is an example for long bone, placed horizontally in the body, no medullary cavity, it is developed from the membrane, it is having ossified from the primary center and the secondary center of ossification. Right? So make sure that you know the difference of the clavicle, right? So it is no medullary cavity, long bone, membranous development. It is developed and it is placed horizontally and it is having primary and the secondary center of ossification. Right? Now, first and the foremost thing, you also have to know the different parts. What I mentioned in the class. This is the spinous process of the scapula, right? This is the medial border. This is the lateral border of the scapula, and this is the dorsal surface and ventral surface. This is the coracoid process, right? This is the coracoid process. This is the acromion process, spine of the scapula. This is the superior angle, inferior angle, and glenoidal cavity. Now we are seeing in the glenoidal cavity head of the humerus articulating to form the shoulder joint. Right? Now this is the subscapular fossa on the ventral surface where the subscapularis muscle is present. And this is the supraspinatus fossa above the spine, supraspinatus muscle. Infraspinatus fossa, that is the infraspinatus muscle. Right? This is the levator scapulae, rhomboides minor and rhomboides major muscle. This is the long head of triceps muscle and in the upper part long head of biceps muscle. Glenoidal cavity, in the upper part long head of biceps, in the lower part long head of triceps. Below the triceps you see the teres minor and teres major muscle. I also asked you to see the bicipital groove. You're seeing the humerus in front, shaft of the humerus, right? Now, two things you have to remember. This is the upper end of the humerus, the lower end of the humerus. This we call it as the shaft of the humerus. Now, head of the humerus, what I am holding now like this circumference, that is the anatomical neck. Now what I am holding here, this constriction, this is the surgical neck of the humerus. So it is anatomical neck where the fibrous capsule is attached. This is the surgical neck where the anterior and posterior circumflex humeral artery anastomose with each other. Right? Now this is the greater tuberosity of the humerus and this is the lesser tuberosity of the humerus. Greater tubercle and lesser tubercle. Between the greater and lesser tubercle there is a groove that is called bicipital groove. Right? This is the bicipital groove where the long head of biceps runs in this groove. And we are seeing the medial lip of the bicipital groove. This is the medial lip. This is the lateral lip of the bicipital groove. Medial lip, you see the attachment of teres major. Lateral lip, you see the petrous major. And in the floor of the bicipital groove, you are seeing the latissimus dorsi. Okay? So, it is easy to remember. Identify the bicipital groove. See the medial and lateral lips. These two are the medial and this is the lateral lip. This is the floor of the bicipital groove. Right? You know in military there is a major post called major, right? And latissimus dorsi spelling starts with L. So lady between the two major. Right? So remember that this is the greater tuberosity, lesser tuberosity and this is the greater tuberosity. And on the greater we are talking about the rotator cuff in this one class. For the lesser tubercle, you see the subscapularis muscle is inserted. On the greater tubercle, you see SIT, supraspinatus, infraspinatus, and teres minor. Right? Supraspinatus, infraspinatus, and teres minor to the greater tuberosity. Lesser tuberosity, you see the subscapularis muscle. This is what we learned in the class as rotator cuff or musculotendinous cuff. Right? So you know the attachment to the greater and lesser tubercle. You know the attachment to the this one, bicipital tube. Right? Now I also wanted to show you. These are the bones which are forming the radius and ulna. You see the radius on the lateral side, ulna on the medial side. And these are the carpal bones which we are supposed to learn later classes. Right? They are arranged in two rows, proximal and distal row. These are the metacarpal bones. These are the phalanges. Right? And metacarpophalangeal joint is this one, and interphalangeal joint. Metacarpophalangeal joint is here. Interphalangeal joints are here. Right? Now, what I told in the class, you keep the arm when you study the upper limb, put it in the anatomical position. This, what you are seeing in the front, is all the flexor compartment. Now, you know this is a part of the upper limb like brachium, antebrachium, arm, forearm, and the hand. Right? So, whatever you are seeing in the front of the arm, that is the flexor compartment, front of the forearm, flexor compartment of forearm, and the palmar surface of the hand. This is the dorsal surface of the hand, extensor compartment of the forearm, extensor compartment of the arm. Right? Now, these are divided by the deep fascia into compartments. What is important, you are seeing in this cut section, the skin has been removed, and you have, what are the structures you are supposed to see in the flexor compartment of the arm. We did not cover in the class, right? But it is also a part of the topic today. Now, in the flexor compartment, first and the foremost thing, when you go to the compartment, list the muscles. Okay? In the flexor compartment of the arm, we are going to see the biceps, we are going to see the coracobrachialis and the brachialis muscle. Three muscles are present in this flexor compartment of the arm. Biceps brachii or biceps, coracobrachialis and brachialis muscle. Now, any muscle present in the flexor compartment of the arm, it will be supplied by the musculocutaneous nerve. So, nerve of the flexor compartment is the musculocutaneous nerve, which comes down, it's part of the brachial plexus.
What is it?
Musculocutaneous nerve is a branch of which part of the brachial plexus?
Lateral cord.
Lateral cord of the brachial plexus. So it is coming from the lateral cord of the brachial plexus, supplying these three muscles present in the flexor compartment of the arm. Let us identify these three muscles first, and the action, the name itself indicates flexion of the arm, and biceps has got, it is main action is the supination of the forearm. Biceps is the supinator, powerful supinator muscle. In addition, it brings us flexion of the arm. Okay? Other muscles, brachialis and coracobrachialis, they bring the flexion of the arm. Now, how you are going to identify this? Biceps muscle, the name itself tells it has got two heads. One is the long head of biceps, short head of biceps. I told long head of biceps from the supraglenoid tuberosity, right? Short head of biceps from the coracoid process. So these are the two different points where the biceps muscle takes origin. From the supraglenoid tubercle is the long head of biceps. From the coracoid process is the short head of biceps. Both the heads meet together and attached to the, you can see, insertion of the biceps is here, okay, to the shaft of the humerus. Now, what I want is how to differentiate the biceps muscle. Long head passes through the shoulder joint. Okay. Now, I want you to identify. See, this is the biceps muscle. Okay. Now, it has got the long head of biceps coming from the supraglenoid tuberosity, passing through the shoulder joint, cavity of the joint, shoulder joint cavity, and this is the shorted. Now, whenever you see a shorted muscle, it is always taking origin from coracobrachialis. So this is the coracobrachialis muscle. So shorted of the biceps and coracobrachialis arises from coracoid process. Both are kept together, right? Now, how to identify the coracobrachialis muscle? So after taking origin from the coracoid process, you see this nerve. This is the musculocutaneous nerve which is piercing the coracobrachialis muscle. Always identify the coracobrachialis, and also along with the coracobrachialis you see the musculocutaneous nerve. Now if I trace this musculocutaneous nerve back, I am going to the lateral part of the brachial plexus. This is the lateral part of the brachial. Right? So coracobrachialis can be identified because musculocutaneous nerve is piercing the coracobrachialis. Along with the coracobrachialis, you can identify the shorted of biceps because both are taking origin from common source. Then the long head of biceps coming from the joint cavity. See, long head and short head, they fuse together to form the biceps. And biceps is inserted to this part of the bone. You can see this bone in the radius, this part, this is called the radial tuberosity. Biceps is inserted to the radial tuberosity. Right? Now, in addition to this, the biceps is also going to form this. You can see this tendon, what I am holding here now. This is called bicipital aponeurosis. This is called bicipital aponeurosis. It blends with the deep fascia. So biceps has got two insertion, one mainly to the radial tuberosity, and in the form of bicipital aponeurosis, it blends with the deep fascia of the forearm. So you can identify the biceps, you can identify the coracobrachialis, you know the nerve of the flexor compartment is the musculocutaneous nerve, and just in the lower part, you can see this muscle here, this is the brachialis muscle. Brachialis muscle, which is present in the lower part of the arm region. You can see this entire thing is the brachialis muscle. Right? Now, brachialis is showing two innervation. It is supplied by musculocutaneous nerve. It is also supplied by the radial nerve because in brachialis is migrated from the posterior compartment, so it carries the nerve supply along with it. So only this muscle in the forearm, it is showing two double innervation by musculocutaneous nerve and radial nerve. Now whenever the brachialis muscle acts, right, what is going to happen? Brachialis is brings, that is the fast flexion and slow extension. Because of the double innervation, you are seeing the fast flexion and slow extension of the brachialis. This action, this type of action, this type of double innervation, we are seeing only in the brachialis. This is called action of paradox. So now you can see this artery here in the flexor compartment of the arm. This is the brachial artery. This is the brachial artery in the flexor compartment of arm. It gives branches to the muscular branches. Students are waiting. Yeah. This is the brachial artery, which is a continuation of the axillary artery. Now the brachial artery divides into two terminal branches, that is the radial and ulnar artery. You can see that we are going to study later. You can see here, brachial artery is dividing into radial and ulnar artery. Right? And when it is present in the flexor compartment of the arm, it gives muscular branches to all the muscles in the flexor compartment of the arm. So make sure that you are all going to identify the muscles in the flexor compartment of the arm. That is, what is it? Shorted of biceps, coracobrachialis,
musculocutaneous
nerve,
long
long head
head
of
of
biceps,
biceps,
brachialis, right? All these muscles supplied by musculocutaneous nerve, except brachialis, which has got additional nerve supply, that is the radial nerve, right? Now, I also want you to see this
Hold on, huh? Okay, yeah.
No, that's like because that's like people who stuck their blackberries on like one local song on like the copy video. So they need to go wherever my camera could just blew up, right? So I start into it. I still like videotape my whole day here because I can't play it.
Sure.
Yeah, 100%.
You cannot bust